Good morning, everyone. Thank you so much for joining us. My name is Tiffany Narvaez, and I am part of the marketing team here at UnitedAg. Thank you so much for joining us on our very first episode of HealthChats. HealthChats is a brand new initiative from UnitedAg, and give me one second as I let more people in. HealthChats is a new initiative that we're enrolling for 2020. It's a short webinar series once a month, the third Friday of the month, and each one will focus on a separate health topic. And this month, in honor of Cervical Cancer Awareness Month, we're focusing on women's health. So today we have Dr. Rosemary Ku, who is our Chief Medical Officer, and she's going to talk about some of the most common women's health issues and just offer some advice on how to live your healthiest life. So a little bit of house rules. Be sure to chat in your questions and we will try to answer those at the end of the webinar. If we don't get to them, we will answer those via email and send it out to everyone. You should have the ability to chat directly to the host if there's a question that you have that you don't feel comfortable asking in chat, but that's it. So without further ado, here is Dr. Rosemary Ku.
Hi,
Rosemary?
everyone. Yes, can you hear me?
Yes, we can.
Excellent. Hi, everyone. Thanks for joining us for the first Health Chats. And as Tiffany mentioned, it is technically Cervical Cancer or Cervical Awareness Month, but I wanted to talk about women's health more broadly because there are a lot of issues today that women actually still have worse outcomes than men in areas of health that are not directly related to the reproductive system. Women's health is only usually thought of as breast and cervical health, but as you know, your bodies are much more complex than just that. And there's certain health topics that I'd like to cover that are not directly related to those two areas. So we're actually going to start off with other aspects of physical health other than reproductive health. We'll go into reproductive health, and we'll also touch a little bit about women's health and agriculture, and we'll end with the review of UnitedAg's resources. So the talking aspect of this presentation will be about 20 to 25 minutes, and we'll try to leave at least 5 to 10 minutes for questions at the end. So first off, here's a list of kind of the health disparities in women that I'd like to cover. It's staggering that women still have worse outcomes in heart disease and stroke, even today with modern medicine. And part of the issue is that women are, oh, sorry, Tiffany, do I still sound staticky? Okay, I guess that's no.
You do sound a little staticky. So can people chat in and let me know if you guys can hear her okay? Rosemary, can you keep?
Mm-hmm. Do you want me to just keep going in the meantime? Okay.
Yeah, let's keep going, and then if people, some people are saying that
Great.
you sound clear, so go ahead.
Thank you. So with heart disease and stroke, both of these conditions are conditions where women will often present differently from men. And so when they go to the doctor or the ER with symptoms, they aren't recognized as having heart attacks or strokes. For instance, in men, a heart attack will often be left-sided crushing chest pain, and stroke could be, arm weakness or numbness on one side. But for both of these conditions, the early symptoms could just be lightheadedness or even dizziness. And for stroke, sometimes it could just be feeling like the room is spinning. And those are often symptoms that can be ignored by providers. Secondly, there's another reason why women tend to have worse outcomes with these cardiovascular conditions is that women tend to minimize their symptoms too. And so I'm saying this not to kind of shine a light on communication or anything like that. It's really to say that, you know, women need to self-advocate for their health earlier on. And I'll give you a quick example is, my mother actually last week came to me and she said, you know, I've been feeling dizzy every time I work out, and as soon as I rest, I'm okay. I know we have some healthcare providers on in the webinar today, and so that in and of itself raises alarm flags of, oh, you have symptoms while you're exercising that go away with rest. That could be something cardiovascular. And then I asked her, well, how long has this been going on for? Oh, and she said, just 3 months. And I thought to myself, wow, you know, you have access to a healthcare provider, and this has been going on for a long time, and you didn't tell anyone. And I've seen so many patients kind of with the same type of story where they just let symptoms go on for a really long time before they go to the doctor's office. So go to the doctors whenever you have kind of anything abnormal in terms of what you're feeling, even if you might not think it's a serious issue. There was also a study done in actually 2 years ago on cardiovascular health in women, and they found that women have worse satisfaction scores with the healthcare providers. They don't feel respected when they've talked to doctors. So that's an issue in terms of not being able to get the right care. But probably more alarming is that the women were less likely, by about 30 to 40% less likely, to receive the recommended aspirin and statin preventive medicines. And so even with the practice of medicine, the quality of medicine, sometimes women are not getting the care they need. And even with strokes, they've shown that women, for some reason, healthcare providers often choose less aggressive stroke interventions for women when compared to men. Now, we don't always understand why this is happening, but I do want to make you aware of kind of this disparity in health quality, so that if you're ever in that situation with yourself or your loved one, you know you just have to advocate a little bit harder to make sure you get the right care. Also, there's an interesting heart attack type called Takotsubo's, which actually primarily impacts women. It's 90% of the patients who have this type of heart attack is women, and they often don't have any cardiovascular risk factors, and it's actually usually induced by a high level of stress. And so just be mindful that there are certain things that actually impact women more than men that are not necessarily reproductive. Regarding endocrine disorders, women are actually 8 times more likely to have thyroid disorders than men. And so if you have, I'm going to actually quickly go over the symptoms of hypo and hyperthyroidism. With hypothyroidism, if you're ever feeling too cold, have a lot of dry skin and hair, are gaining weight, feeling very fatigued, you might have a thyroid issue. On the hyperthyroid side, if you're actually losing weight without even trying, or if you, if you feel like you're running warm all the time, or even having heart palpitations, that might not actually be in your head, and most likely it's not. And having a full workup to make sure your hormones are all balanced is really important. Autoimmune diseases are actually much more common in women. In fact, 80% of people with autoimmune disease, including multiple sclerosis, rheumatoid arthritis, lupus, myasthenia gravis, and autoimmune thyroid disease, 80% of those are actually women. We don't always know why that is. There's some theories that say it's because of women's hormones that actually cause the overactive immune system in these conditions. And if anyone has an autoimmune condition, you know that those symptoms are usually very insidious. They come on kind of gradually, and they can be pretty subtle in the beginning in terms of fatigue or achiness, or even feeling just down or having brain fog. So please don't ignore any of those symptoms. Urinary tract complications and complications of sexually transmitted infections impact women much more than men, unfortunately, and that's largely due to anatomy. A lot of women who come to me with urinary tract infections will say, did I do anything wrong? Was I unclean, or, was this a hygiene issue? It's absolutely not a hygiene issue. It's because of the anatomy of the female organs. And then I do want to make a few points on sexually transmitted infections. For a lot of men, STIs are asymptomatic, as they can be for women as well. But for women, even gonorrhea and chlamydia infections can cause something called pelvic inflammatory disease that can lead to infertility. And so the consequences for women of some of these sexually transmitted infections are just much worse for men. And also, I do want to point out here that human papillomavirus, which is the cause of cervical cancer, is a sexually transmitted infection. And it's not something that men are tested for ever, but they're the ones who transmit it to women. It's highly prevalent though, and most women are vaccinated at a young age for the HPV virus. But the vaccine actually only covers the most highest risk strains, and it doesn't cover all of them that could potentially cause cervical cancer. Even if you're an older woman and you've never had the HPV vaccine series, it's still probably a good idea to get it if you're sexually active. So just because your doctor says, oh, you're past the age of 25, you probably don't need the HPV vaccine. If that's something you think is that you'd want to protect yourself from cervical cancer, you should absolutely get it. Okay, and then we're going to actually transition to another area where women actually have a much higher rate of worse outcomes, and that's behavioral health. So women have 2 times higher risk for depression, post-traumatic stress disorder, anxiety, and panic disorders, and also about 95% of those with eating disorders are actually women. Women also have higher rates of phobias and OCD. And overall, there's a lot of stigma in behavioral health. And I think for women patients who go to see their providers, that there's almost too much, there's an inclination to say, oh, this patient is being overly emotional, or, there's something like, going on, this is related to her period, or, there's a lot of unconscious biases, unfortunately, in medicine. But there's been studies to show that the reason why these behavioral health issues are more common in women are because of social issues, and it's not because of emotional or psychological gender-related issues. So for instance, women actually have a higher poverty rate. They have a typically lower pay, even within the same pay grade as men. 1 out of 3 women have actually experienced domestic violence, which is a huge contributor to post-traumatic stress disorder. And the stressors that women face today are potentially greater than they were before. So 65% of caregivers are actually women. And if you compare men and women caregivers, the women caregivers on average spend 50% more time in caregiving activities than male caregivers. And so that puts a huge strain and is a risk factor for behavioral health issues. I just want to highlight here that, what UnitedAg is actually looking at caregiver support services for our innovation pilot program. And, the things that we look at for that program are not just for marketing or, that sounds kind of nice and fancy. We're looking at things that actually can impact the social determinants of health. And obviously, by what I've just said, caregiving and spending a lot of time doing that and the stresses related to that is actually a key social determinant of health. So let's switch gears to reproductive health here. I will send Tiffany this deck after the talk, and she can circulate it. This is a nice chart from ACOG, which is the Professional Society for Obstetrics and Gynecology, and they basically rank all of the birth control options here based on effectiveness. So we're going to first kind of talk about, if you're not trying to get pregnant, we're going to talk a little bit about pregnancy health, and we're also going to talk slightly about the postpartum period too, as part of the reproductive section of this talk. And so probably the most common question I get on birth control is which birth control does not have a hormonal component, because a lot of women don't like the hormone side of things. They feel different on it because of the hormones, and the majority of birth control are actually hormonal based. So anything like the pills, the patches, injections, the vaginal ring, those are hormones, they release hormones. The one that is, aside from kind of barrier methods, the one option that's non-hormonal and is not permanent is the copper IUD. A lot of people forget about this, is if you don't want hormones and you don't have other indications for birth control, like if your periods are too heavy and you need to control that, those are actually better done with hormonal birth control. But if you want a non-hormonal method, a copper IUD is the best way to go. Okay, so say you're past the age of wanting to always have birth control, and you're thinking about starting a family. What do you need to do to optimize fetal and neonatal health? And the very first thing is to make sure you yourself are healthy. Most of the fetal and neonatal complications actually arise because of poor maternal health, and those are actually around chronic conditions like diabetes or high blood pressure. Also, talk to your doctor as soon as possible in the family planning process to make sure you have the proper nutrition. A lot of people know that folic acid is critical in early pregnancy. In fact, the first few weeks and then within the first trimester of pregnancy is when the neurological system is developing. So you really need to get enough folic acid to minimize any risk of birth defects. So talk to your provider early, even before you're pregnant. The second, and this especially applies to agriculture, is minimizing exposures to chemicals and pesticides. Some pesticides are worse than others, but based on the CDC's recommendation is that they view all pesticides as having some risk and potentially leading to miscarriages and birth defects. And pesticides can actually get into the breast milk. So if you've given birth and you're breastfeeding, you have to be cognizant of those kind of exposures, not only for yourself, but if you have other family members who work in agriculture, or you live near a farm where your pet might be exposed to pesticides and they bring that back to the house, you have to be really mindful of making sure that outside clothes stay outside and that's not tracked in and exposed to you and your food. And then lastly, there's a higher risk of carbon monoxide poisoning in agriculture because of all the heavy machinery that can be used in certain circumstances. And carbon monoxide poisoning essentially decreases the amount of oxygen that gets to your tissues. In a non-pregnant person, that can cause, a lot of different types of symptoms, but for someone who's pregnant, it can actually be detrimental to the fetus, because that means that not enough oxygen is actually getting to the baby. So make sure that if you're around heavy machinery or potential like fumes, make sure there's enough ventilation so that there's no risk of carbon monoxide poisoning. And so hopefully you've given, birth to a nice healthy baby. What do you have to think about in agriculture afterwards? We've already talked about the fact that pesticides can get into breast milk, so you want to make sure your work clothes stay at work. Second, make sure you ask about any lactation resources in your workplace. And postpartum depression is a huge issue, and it's usually undermanaged and underdiagnosed. So if you have a worsening mood, or you aren't as interested in things that you normally like doing, those are signs of depression. You should really talk to your doctor as soon as possible about it. And then lastly, I do want to make sure that you're mindful of the fact that if you have a newborn and you're up all night feeding them and taking care of them, that lack of sleep will decrease your reaction time. And so they've actually shown that when people are sleep deprived, they basically have the reaction time of being under the influence of alcohol. So that's especially important for occupational safety. And now let's move on to preventive health screenings. So we will touch base on the cervical cancer screenings here, but we'll first talk about mammograms, which are recommended for women starting at age 50, and you should have a mammogram every 2 years. Now, the starting age of 50 has actually changed over the last few years. Some of you might remember that the previous age recommended was actually starting the mammograms at age 40 for the general population. So it was highly controversial for them to change this, but the reason why was because a lot of younger women under age 50 who are having mammograms were having basically false positives because of the fibrous breast tissue. And so what the U.S. Preventative Services Task Force does is they look at the pros and cons of the screening protocols, and they ultimately felt that with the latest data, it's better to wait until age 50 to start the breast cancer screening. Now that's for the general population. If you have a family history of any type of cancer, and especially breast or ovarian cancer, you should let your doctor know so that they can kind of cater the screening and preventive strategies to your level of risk. And so this is really just kind of recommendations for the general population. On the cervical cancer side of things, if your ages between 21 to 29, you're supposed to have a pap smear every 3 years. And then between the ages of 30 and 65, you have a few choices. You can continue getting the pap smear every 3 years, or you can do the HPV test, the human papillomavirus test, with or without a pap every 5 years. And these, the duration, the interval of testing, like the 3 or 5 years, is actually assuming that your previous test was normal. So if you had an abnormal pap, your gynecologist will actually have a different kind of screening protocol for you, and they might want to biopsy to make sure all the cells that they see on your cervix are normal. And kind of on that same vein is, say you're in between screenings, but if you have any abnormal discharge, if you have any kind of pelvic pain, or any abnormal bleeding, that means either spotting between periods, or if you're having vaginal bleeding after menopause, you should absolutely see your doctor sooner, even if you're not even due for a pap smear or HPV test. And the other preventive health screenings that I want to make you aware of are diabetes screenings. This is for anyone who is overweight or obese. The U.S. Preventive Services Task Force recommends that you be screened for diabetes. Of course, this can also be evaluated on an individual basis with your doctor. Colon cancer screening has a lot of different options. It ranges all the way from annual stool testing to a colonoscopy every 10 years. The screening usually starts at age 50, and you can talk to your doctor about which method you would like to do that kind of fits with your lifestyle the best. And then I just want to highlight here that with both ovarian cancer and endometrial cancer, unfortunately, there is no screening for the general population. And so, I mentioned earlier, if you have a family history of any type of cancer, really, you should let your doctor know so they can evaluate your own personal risk and to act accordingly. Now, so cancer actually usually is a two-step process. There's usually a genetic component and a lifestyle component. Now, we don't understand all of the reasons why cancer develops, but you have to control what you can control. And here's my recommendations for good women's health maintenance. The first is to avoid excess alcohol. Now, women, unfortunately, should not have more than 1 drink per day. Men are actually allowed up to 2. But women, the recommendation is actually less than 1 per day. I'm sorry. And then the second is to avoid all types of alcohol, and then also to maintain a healthy weight. There are studies that show that increase in weight and kind of the complications of that with kind of worsening blood sugar and insulin sensitivity is actually a risk factor for cancer development. And this doesn't mean that, and I'm not talking necessarily about falling within the BMI categories. I'm talking about, talking with your provider to figure out if you're a good healthy weight for your frame based on the type of physical activity you do. Because weight is not necessarily the end all be all. You know, muscle mass is actually, contributes a lot to weight, but is actually healthy. So talk with your provider on whether or not you're at a healthy weight for your frame. And, you know, stay active no matter what. You know, all of the you know, all of the general health recommendations really call sedentary activity kind of a type of smoking almost. It's just sedentary activity is not good for our health. We need to kind of be up and walking. The recommendation is at least 150 minutes of moderate intensity per week. So that's 75 minutes of vigorous activity. Now, you know, you don't necessarily have to kind of you know, count all the minutes. And I know I've said before that there's a lot of different ways to kind of stay physically active. Even if you don't have enough time, interval training where you kind of raise your heart rate up and then bring it down and rest a little bit and then raise your heart rate up again is very effective at maintaining good health. And it doesn't require the full 150 minutes per week. Maintain proper nutrition. So the three most important nutrition supplements for women, not necessarily supplements, but if you're not getting enough in your diet, you do have to supplement. Those are calcium, iron, and folic acid, especially if you're of childbearing age. And then lastly, I do want to always emphasize that we have to prioritize sleep. Poor sleep is actually one of the largest risk factors for behavioral health issues, including depression, anxiety, and also substance abuse. And so anything that you can do to prioritize yourself and make sure you can get enough sleep will not only improve your physical health, but also mental health. And so I'm gonna kind of end there in terms of content. I do wanna make sure that you remember we do have our health and wellness centers that you should go to. All these things that I've talked about, go see your provider and have them assess your risk. I know not all providers and all health systems have enough time to talk with you and get to know your family history, but the ones at our health and wellness centers through our partnership with Elite are absolutely fantastic. They have the time to listen to you with your concerns, and they will follow you over time. So it's not like an urgent care clinic where you go one-off and get an antibiotic and you go away. You know, our providers are absolutely lovely, and we get that feedback all the time that they really develop a relationship with you. So definitely, if you haven't had an annual checkup in terms of health or women's health, please make an appointment at your nearest health and wellness center. And then if you do need any care in between, or you prefer a video visit instead, we also have Teladoc as one of our resources. So I know we covered a lot of ground. I'm gonna pause there and see if there are any questions.
Thanks, Rosemary. I'm not seeing any questions in the chat feature. We'll give everyone a couple of minutes in case you do want to ask any questions. I do want to let everyone know that our future webinars, some of them will be bilingual, English and Spanish, so that is something we're very excited about. So keep an eye on your inbox, and next month's HealthChats will focus on heart health, and that is scheduled for February 21st. We will send an email out with more information, but please keep an eye on your inbox because we'll be sending a survey out in the next couple of days just to get your feedback on the timing of the webinar, the links, and all that good stuff. But I'm still not seeing any questions, so Rosemary, do you want to add anything else?
No, I don't think so. You know, I covered a lot of ground, and if anyone wants to reach out to me afterwards, the email is just dr.rosemary.ku@unitedag.org.
Thank you so much. This was very informative, and thank you everyone for joining us. Have a great weekend.